Hi everyone, and I want to welcome you to Pharmacokinetics and Routes of Administration. Pharmacokinetics is a process of how medication gets to the target site and what happens to the medication during the journey. So pharmacokinetics follows a drug cycle, and that includes or involves absorption, distribution, excretion, and metabolism. This is the drug cycle that pharmacokinetics follows the pathways of. So first we're going to talk about absorption. And there are certain things that may impede or impair the speed of absorption. That can be the route of administration, whether the medication is IV or PO, topical. Say if the patient has scars or tattoos that may impede or impair the rate of administration of a transdermal patch. The solubility of a medication. Is the medication oily? Is it really watery? When you pull up a medication in a syringe, sometimes you can see it can be an oily or very fat-soluble drug, and that will be affect your speed of absorption. The age of the client. Is it a newborn or an elderly person? Food. Does the patient have food in their stomach when they take the oral medication? If they have food, it may not agree with the medication and it may affect the rate of absorption for that medication. So these are just some factors that you have to take in consideration when we talk about absorption. Okay, so talking about distribution, this is the transportation of medication to sites of action by bodily fluids. There can be some barriers to this, such as the medication may be a water-soluble drug or a fat-soluble drug. With water-soluble drugs, they tend to stay in the bloodstream and they have slow absorption into the tissues, while a fat-soluble drug is distributed to the tissues more quickly, and the more lipid-soluble the drug is, the higher its ability to reach the cells of the body, which are the target cells, which is where we want the medication to go. So metabolism is also known as biotransformation. And this is when medication changes into a less active or inactive form. And this is usually done by enzymes within the body. This occurs primarily in the liver. Metabolism, biotransformation primarily takes place in the liver. Yes, it also occurs in the kidneys, lungs, bowels, and blood, but primarily metabolism is the liver. So because metabolism takes place in the liver, it's very important that we have a good functioning liver. So some medications may require liver monitoring, so you may have to draw some blood serum levels to monitor the functioning capability of the liver before you give that medication. These are the type of factors that as a nurse it's important that you know. So you have to know if a medication is metabolized in the liver. So take, for instance, your patient has cirrhosis of the liver. They would not be able to process certain medications effectively. And because of that, the medication would build up and the patient would become toxic. So it's very important that you know the condition of your patient and whether or not the organ that metabolizes the medication is functioning fully and properly. So there are some other factors that may impact metabolism. And this is just a list of some of them: age, gender, metabolizing enzymes, genetics, gastric emptying and gastric acid, tolerance, vascular insufficiencies, nutrition. These are just some pathways and some mechanisms that may impact metabolism of certain medications. So while we're talking about the liver, it's important that we talk about the first pass effect. Now this first pass effect is usually with oral medication. So in order to bypass the first pass effect, we give them medication by an alternate route, such as IV. That way it gets into the patient's bloodstream a lot quicker, and the patient has relief almost immediately. So we're moving on from the liver, now we're moving to the kidney. Excretion primarily occurs through the kidneys. Elimination takes place through the liver, lungs, bile, and exocrine glands, but excretion primarily occurs in the kidney. So just like the liver, there are some things that we have to take in consideration with the kidneys and excretion. Medication dosing attempts need to maintain a plasma level between minimum effectiveness and toxic concentrations. So we want to make sure that we have a therapeutic level. We don't want it to be toxic because that can damage the kidneys. To avoid toxic effects from medications, especially whenever we're looking at kidney and renal function, we want to maintain a therapeutic index. Medications need to be within a safety margin and have routine medication levels drawn so that we can see that the patient is toxic or if the therapeutic level is within range or the desired dose. Because we are monitoring patients for therapeutic drug levels, we may have to do what's called a peak and trough on certain medications to guide us on the dosing of certain medications. So trough level is blood drawn immediately before the next dose of medication is given, regardless of the route of administration. So if it's given IV, you are going to draw this anywhere from 15 to 30 minutes prior to giving the medication. If you're looking at a peak level, that's the highest the serum level, and that's going to be typically drawn 15 to 30 minutes after the medication is given. You're going to see peak and troughs levels drawn with certain medications such as vancomycin. Vancomycin is an IV antibiotic we give commonly for patients with MRSA or they've got some type of overwhelming sepsis. We have to monitor their peak and trough levels with vancomycin. Failure to monitor a vancomycin level can result in long-term and irreversible renal damage. So you can have kidney damage from not monitoring the levels of a peak and trough, especially on a medication like vancomycin, which is given in the hospital all the time. So as a nurse, it is crucial, it is your responsibility to know what medications warrant serum monitoring before and after you give it. Failure to do so is a medication error, so you can cause harm to your patient when you fail to follow peak and trough instructions that can be found in your drug reference. So it's very important that you understand the half-life of a medication. So half-life of a medication is the time required for half of the medication to be excreted. So once again, we're talking about the kidneys. So how long does it take for that medication to be excreted? So do you ever wonder how someone knows the interval in which to dose a medication? Well, that's based on the half-life. For instance, a medication that's given every 4 hours for pain has a very short half-life. That's why you can give it every 4 hours. Whereas some medication have a long half-life. With a long half-life, the medication may be required once a day. So the shorter the half-life, the more frequently the medication can be given. The longer the half-life, the less frequently the medication is given. So now we're going to move on from half-life to loading doses. So a loading dose of a medication is given when you want to reach a therapeutic level quickly. So for example, we're going to give Lanoxin for a patient who has an elevated heart rate. The doctor's going to order Lanoxin 0.5 milligrams to be given IV now. That's going to be our loading dose. It's a large amount. Once we give that, the doctor's going to say, now I want you to give Lanoxin 0.25 milligrams every day. So that's going to be your maintenance dose. But we want to get the larger amount of medication into the patient's body as quickly as possible to reach a therapeutic level as quickly as possible in order to bring that patient's heart rate down. So that is your loading dose. In pharmacokinetics, newborns, their needs need to be taken into consideration. You have to understand that because an adult gets a medication, it may not be possible or even feasible for that newborn to get the same medication. So dosing has to be carefully monitored when given a child, infant, newborn medication. So just like newborns, our elderly population, certain considerations have to be taken into account as well. So with the elderly population, there's a decrease in a lot of activity that will change your dosing amount and frequency for certain medications. So make sure that whenever you're looking at your drug reference, that you're looking at any special considerations for newborns or the elderly population. So now we're going to talk about routes of administration. And as you see, there is an extensive number of routes of administration that we are going to review and go over. So the first route of administration we're going to talk about is oral or enteral. And these are medications that pass along the GI tract. So some things can impede or affect our oral medications, and that can be the stability and solubility of the medication, the pH and emptying time of the stomach, presence of food in the stomach or intestines, other medications given at the same identical time, and the form of medication, if it's enteric coated or it's a pill. So whenever you are looking up your medication, you need to look up and see, can you give that medication with food or not? Can you crush that tablet or not? So make sure that you're looking at those type of things whenever you're administering your oral medications. When we're talking about oral medications, it's also important to look at some contraindications. So for instance, if your patients have nausea, you can still give your medication. However, if they have absence of a gag reflex or difficulty swallowing or decreased level of consciousness, you're not going to be able to give them an oral medication. You're not going to be able to get that patient to swallow and have it be effective without it causing some sort of aspiration. So you need to know the condition of your patient's swallowing ability before you give them any type of oral medication. Also, when given medication, like we talked about earlier, are there any food or beverages that you need to avoid? Grapefruit juice is one of those things that you just don't give with medications. There's the acid and there's a chemical in that grapefruit juice that oftentimes interacts. So you may have a less effective medication if you give it with grapefruit juice. Another thing to avoid is alcohol. So do not give certain medications, especially something like an opioid, with alcohol. So take in consideration foods or beverages that you may want to avoid giving with the medication. So whenever you're giving medications, it's important that you follow the manufacturer's suggestion or directions regarding crushing or cutting or diluting a medication. If you have an enteric-coated tablet, you cannot crush that and give. If you have a timed release, which is a TR abbreviation, timed release, you can't crush that or cut that open either. Extended release, which is XR, SA, which is sustained action, SA, and SR, which is sustained release. Those type of medications you cannot cut or crush, but always look at your manufacturer's suggestion when it comes to these type of enteric-coated or timed release medications. And if you're using medication in a liquid form, make sure that your patient does have the ability to swallow. Sublingual or buccal medications are both an oral type of medication. Sublingual is under the tongue, and buccal or buccal, however you want to pronounce it, is between the cheek and gum. So you always want to make sure that the patient does not drink anything while they have the tablet in place. If their mouth is dry, they can have a sip of water prior to taking this medication or putting it under the tongue or between the cheek and gum. They can take a sip of water beforehand. Note that any medication that is ordered sublingual or buccal, that cannot be crushed and given through an NG tube. It has to be given by the route it is prescribed. Sublingual medication has a rapid onset, usually 1 to 3 minutes, so that sublingual medication is given that way for a reason. If you give a sublingual medication orally and the patient swallows it, it may become ineffective by the gastric contents of the stomach. So that is why a sublingual medication is given just as such, sublingual. When you are giving liquid, suspension, or elixirs, you're giving this in an oral form. Make sure that you are measuring the base of the meniscus, which is the lowest fluid line, and that's going to be the desired amount of medication you're going to give. So whenever you're given any type of oral medication, whether it be liquid, tablet, sublingual, always make sure that you stay with the patient until they have taken all of the medication you are giving them. Transdermal medications release a small dose of medication over a period of time. Before you apply a new patch, you need to make sure that you remove the old patch, fold it with the medication onto itself, and then throw that away in a trash can or a receptacle with a closed lid. When you get ready to apply the new patch, you're going to select an area that has the least amount of hair or that is hairless. You can wash the area with some soap and water and make sure it's dry thoroughly before you put the new patch on. Also, before applying the patch, you're going to make sure that you date, time, and initial the patch, and then place it on the patient. When applying a topical medication, you're going to always wear gloves. You can use a tongue blade or a cotton tip applicator, but never ever use your bare hands when you are applying a topical medication. When you are placing eye drops or eye ointment, always wear your gloves. When you are using the ointment, it should be a very thin line and place that in the conjunctival sac area. But you're going to always wear gloves when you are instilling eye drops. Placing ear drops in your patient. First, you want to make sure that you inspect the ears for any visible signs of drainage. If you have any drainage present, make sure you have on gloves. Remove any exudate with warm water. You can use a warm washcloth to remove that. After you administer the drops, you can apply gentle pressure to the targus of the ear, and that will facilitate the movement of fluid down the ear canal. Ear drops for an adult, you're going to pull the ear back and up. For children, you're going to pull the ear back and down. So this is the administration of eardrops for adults and children. Given medications by an NG tube or some type of gastrostomy tube, you're not going to give any medications that are ordered sublingual down an NG tube or a gastro tube. Do not crush specially prepared medications such as those extended release tablets or enteric coated tablets, or even the liquid filled tablets. You're not going to crush those. Use only liquid forms of medication. If a liquid form is not available, you are going to have to crush the tablet, mix it with warm water before you give it or administer it in the tube. Some medications cannot be mixed with food. If the patient is receiving, so let's move on to NG tubes and G tubes or gastrostomy tubes. With the NG tube and gastrostomy tube, you are not going to give any type of sublingual medication through these tubes. Those are going to be given sublingual as ordered. You can, however, give tablets or pills that are crushable, and you can give all forms of liquid, which can easily pass through the tube. You are not going to be able to crush or open medications that are timed release or extended release or even fluid-filled or enteric coated tablets. You cannot break those down and give those through an NG tube effectively. So if the patient has a medication that's an extended release tablet or an enteric coated tablet, it is your responsibility as the nurse to call the physician and ask for an alternate route, or even check with the pharmacy and see if there's an alternative route available that can be prescribed for the patient. But you're going to have to coordinate with your team players, your team members, to come up with a solution to give the medication to the patient, especially in the proper dose that needs to be given and the route. Also know that whenever you are administering medication down one of these tubes, that you are going to need to flush that tube frequently with water. You're going to have to prevent any type of clogging. I know it says sterile water, but you can use tap water as well, as long as it's some warm water. You need to flush it frequently. You're going to have to count the amount of water that you use as part of your intake, but you need to flush that tube pretty frequently. Because if you don't flush the tube after you have administered either tablet that's been crushed and diluted or even a liquid that could be sticky, it can clog that tubing. If it is a PEG tube, which is a surgically implanted tube, and it becomes clogged, the surgeon is going to have to come and take that patient to surgery to replace the tube. If it's an NG tube that you're giving the medication through, a nasogastric tube, if the patient's alert and that tube becomes clogged, you're going to have to remove that tube and reinsert the tube. So you're causing your patient some distress when you're doing that. So always be mindful of medication that you are giving through an NG tube and flush frequently. Always wear gloves whenever you are inserting a suppository. Follow the manufacturer's directions on storage. Make sure that you have the patient in the proper position prior to inserting the suppository. See if there's any type of stool or infectious material that could be in the way of the absorption of the suppository. Once you get the patient in the position, you have your gloves on, you're going to lubricate the suppository before you insert it, but always make sure that you are wearing gloves during the insertion process of any type of suppository. For a respiratory medication, which is an inhalation type medication, we're going to be talking about Mdi inhalers, which are your metered dose inhalers, and your DPI inhalers, which are your dry powdered inhalers. For your MDI inhaler, your metered dose inhaler, always follow the manufacturer's recommendations and suggestions for the administration of these inhalers. Always give that inhaler a good shake prior to having the patient put their lips firmly around the mouthpiece and inhaling. The same goes for your DPI, which is your dry powdered inhalers. Always follow those instructions for the administration of that. Know that it is a capsule or a tablet looking that you place inside the inhaler, and once you close the mechanism, it disperses that powder, and that's what the patient inhales. A spacer is an excellent device to use when delivering an MDI medication. You would use this the same way as you would give the medication without the spacer. You're going to have the patient place their lips firmly around the mouthpiece and take a good deep breath. The spacer holds the medication within a confined space so that patient can inhale it maybe a second time if they need to, but it just kind of keeps that medication detained so it's easily inhaled. So now we're going to move on to IM injections. So with your IM injection, if you have a pre-filled syringe, you are not going to remove the air bubble prior to administration. A pre-filled syringe is something like Lovenox that comes in a pre-filled syringe. So that has a little tiny air bubble in it, and you're not going to remove that. Know that with any IM injection or sub-Q injection, that whenever you pierce the skin, you are not going to pull back on the plunger. You're just going to push in the medication. So remember, do not pull back on the plunger when giving these types of medications. If we're using a tuberculin syringe, that's usually for medications of less than 0.5 milliliters. Anytime you're giving a injection on a routine basis, make sure that you're rotating sites. It's important that you move the injection sites around because that helps to enhance the medication absorption. And then you also want to make sure that you document the site in which you gave the medication in. Be mindful of edematous areas that are inflamed. You don't want to give an injection at a mole. You try to avoid birthmarks, and of course, you're going to avoid any scarring for your injectable medications. If you're caring for a patient that's receiving an IV medication, you're going to have to monitor for those therapeutic effects and side effects, and we'll talk about side effects at a later time. You're going to discard any sharps, broken amps, bottles, and needles. You're going to make sure that you put those in a sharps container, a puncture proof and leak proof container. You're going to make sure you discard any unused material in that. Know that patients will and visitors will stick their hands down inside of a sharps container and try to pull out needles or vials that they may see have medication in it. So be mindful of that. Make sure that you are discarding everything properly. When you're giving any type of subcutaneous medication for those abdominal injections, like for insulin or heparin, make sure that the injection site is at least 2.5 inches away from the umbilicus. For an intradermal medication, and this would be tuberculin testing when you get your TB, or it could be for allergy testing. You're going to see a little wheal or well develop there under the skin. Make sure that you're doing bevel up for this particular injection. When given a sub-Q injection, you're going to give that into the fat pad area of the abdomen, upper hips, upper arms, and thighs. This is generally a small gauge needle, 25 to 27 inch gauge. For an obese patient, you're going to go in at a 90-degree angle. For an average size patient, it's going to be 45 to 90 degrees depending on the area of the injection site. IM medications are appropriate for irritating medications, solutions mixed in oils, and aqueous suspensions. This is usually an 18 to 27 gauge, and it's 1 to 1.5 inches long, and it's always given in a 90-degree angle. The volume for an IM injection should not be more than 3 milliliters. So if you have anything greater than 3 milliliters, that will need to be a divided dose. And yes, you would have to give 2 IM injections at 2 different locations. There are some medications that you give IM, such as iron. With iron, you're going to use what is called a Z-track method to instill this medication, and that prevents the medication from leaking out of the skin and staining the skin. So here is an example of the Z-track method. This is just a diagram showing you the various sites of subcutaneous injection areas. You see the abdominal area, upper thighs, and the upper arms. These are the most common areas to give your insulin injections. So this is just a diagram of showing you the various areas where we give IM injections, and these are just common areas for those injection sites. Epidural medications are given for pain or anesthesia purposes, such as for a C-section, or it can be for the delivery of pain medication for someone who has chronic back pain, or even some steroid injections can be given by an epidural method. So intravenous medications, this route of administration is the quickest absorption. It goes directly into the bloodstream. So know that whether you are giving an IV medication, IV push, or IV piggyback, as a one-time dose, as an every 4-hour dose, however you're giving that medication, that is the quickest route of absorption. So if you are pushing that medication by an IV direct push and the doses needs to be delivered over 2 minutes, you have to stand there 2 minutes and deliver that dose of medication over that period of time. So if you go faster than what is recommended, there's a possibility that your patient could stop breathing, they could have a seizure. There are several things that could go on. Once you start giving that medication, you cannot take it back. So IV calculations have to be precise, and you really need to follow your drug reference on